Shidna, Shady Perphelia Fowler, Dashijin, my deskis in Schlan, Toritini, Bashin, Trabaha Edashe, Adult Ashe Edashanale, Totis Aholieda, Ade, Yusinasha, Ado, Patara Zande, Shina Nishnat, Kokodo, here, Kojahanada, so Gizdo, so the Zenlini Ebe are nail in Kodoshe, so the Zendole. Kodohojon dole, Nahastan Chamahia del Hill. The Indian Edan of Lini, that Ade, Jindo, J. Benebi, Aya, Pont, Teddy. Nihitodas in Nahatadi dole, Nihi Nahatati, that the yin dole. Ajin to go coins quick, not Nakayeta, Ado the quiz Kanye, she inquires. The Cosentanas 8 other, Bebet Ojo, Con Hitantni. Ado Hashinto Con Nihik A dan Lini, till cage case Tuisani dan Lini Con. Nihit art knees Latin Conde, Hashto it Adole. Nasco net Nij, Pitcher Haini Ligo in Hinson. Nihit Jabets Hell Inson. Nihin take case, Bitskell Naha Inson. Nasgone Nijayat Ehon Hitna Widot Al. Ado Hashin to go con is the Bakajo but a day needs and a Bakato that deals in there. Nahashta Ila, do a head and he needle left in the Nedan of Lini. Is the Lini Death Nini Babichin or Bahi Kodon Hitcha Hotla. Nikides Nigo, Insend on Le Chamana Hassan Yadet Hill. The internet on Lini is a Lini Konaha Daliai, Nikita Desni dole, Ado Aton Hata Alnehi, Edo Naha Dalia dole, Asa Anitzano, Benacha Behana ini Nigo en Kimson, Adon Hitnahas Ago, Niki Konta del Cleon, Hiwanesh Kishnas Tago, Nikit Hotnas Cargo, Nikiteskenas Lago Yat Ego Con. Nihina de yes cartole, nasco ne ado conihina gloshi dan lini con yat ehon nada credole con bahojoni it a contro yes dan hienda hasli a hehe chidi and the edan of lini con ado hashin to go conihit the ne lini cons tuisani till kgk benanish nicht eba althat nicht. Is a in dan lini is a ne katan lini artsko. Yat eko nakapa akoliado le, yat eko nakata haliado le artsko. Aronat ani dan lini kompesh pasa anatrat naznile. Adol hotin hesh jipe dabet ochehida artsko. Dini hilka hot zo gido dan ade hon yat eko hilna hot atole shamana hastan yadil hil. Ado Hashin to go con and Lenny da Nini Juno na happy gatas lido len hit the nair arts. Ye Bicachan nani lido let yaton hit nahot at all. Consaga eight others and Lini anshen the Behanana street dole. Adi de ben hit Vajana Hasling. At this time, move it forward to our Honorable President Nez. President.
Sister. We're good, Eli? Thank you. Arnold so aren't dan ich nalkido da is not agi kodo a Dr. Fowler naha citizen ye hat zi kunde anil tsoshi binda citizen behada si zi konig enig in napa ado ni jo ba inch ke chik eroshin kon ni nat ani kodo shna Albert Hale jain hitsa jitten do kon balchin yil ina il inigido vike nlenigi eshido bejedastel so edo kon batsodil zanash wanish ke notlini Anils kushinkon nihine do das telot at nebiki apka jakon hinat anin lo la anache la jena das da na khayaltio aron le hos do ha hot zoje na khana ga aye ho gando de ho gan ajen khanat anin lo la anache aro kodo bizza chindo ye hat ze ibe bedel nicht olel shikeroshna yego na khayaltio na khadetslo benane shila ado kon edan lenigishi edo he dabdi nido leltiche ado danat ai le de nebike apakao e ya alliona dahandat atolel tadi no hota ishi benach bedel nicht olel shikeno lini ado kon alchin dan lenigi tsok dan lenigi ishi do bedel nicht olel zu de zenbe shikeroshna ado kon le hos do denshi nabdo gel olel kon de nebike apakaje alena ado bikje dashin ade hos do den don le pace and that Aron le Winslow Aro adenshi nabade gel olel so la shi ya atki baho dan ich nach olel ade nabade gingo ada hasya ya atki baho ado ishi benach ko la ahe shi dadi need olel ade nabdo gyan did nebike apakaja aro kodeshi tsaga ho zandeshi eko ak edan linigi do bakaiche behen nihigi shi eko hashi adel ne dolle aro achdeshi bi indaso trago jogot a yadi naslnigi binina hot a anda al inkadije وخط نكيني هنا لا أدا جدا أرو هيت أكيجي بكادش والنصنو بس ودا بيج إيان دا بي جو إياد شدي بين سو كيرغو شين إيه أكون هذا أكيدان لنجي بيجو كدا دو ليش كينو ليني so إيشي دي هنا إجيا دي داني خنالجي بيه جو بهزن دولة دي ناسو na skada jobe hazendolel so ya kon shna Albert Hale bada ilne dolel shida bishin shishna shoda ani na sha na ani na khanlo bichetin shilende shna do yaltki egi benach just be Ashin lan shido ashin shlo ebna benache shna bedishnil lata besh lo lende jo hot elia deneni klio khana khutsalada khudejida na khadada ba jot lo ya ok benache ot ya nihya da ho agi akhot ya alkai je do benach shido bedel nicht olle chako nakhayalti odo belhajon akhot nakhanaga khot shi bedel nicht olle tenabike yapakha odo ode do ade shikero shidna keda hatnigi lanko nik eni hinne do belgana dan leniginde kodo bjeda stilto sad be hadainol nenigi ye hadastzi eshindo bedalni tolel to hadainol ne shikenol lini judinal nigi andi kunal ni gon banda huilne a kuich ada halnyado ni zedo ni chip kidast trada do kani la trala wash be trada kis ara yedigot yadalti hagan da sotra Dadi no hot be yeltje Jokonat ani nit linigi a kuichin kontradi ka bada huilne ada hasya dadi no Jokon ya shikero shidne kadoshin shna nihinat ani bedel nicht dolle do hada inolle di kon baden da huilne hegi ya na kijin da annashna di jin da annashna abinigo nezna ol kilo ya di kon de nebikia paka okay huit inigi na din tsepi de mil yajdoba ashla neza din doba dis din doba din elt au kon ki keni hinne beda dolna ayat en das slingido yich das kregi dit at de mil yajdoba tsepi neza din doba dit at da nelt au kon ki keni hinne Yat en das sling. Yat en das sling ich das kind la kon ich keni na an die bchen das die bezies an die bchen das die ota. Edo ba da huilia kon ich keni na ashode. But so dilzen. Aro ashi yat en da dot le ota. Ebinina dan ich die ne konzel in agenda neshki is nicht de nazel in dan lenigi. Kuda kuichi kuda ashonde da no ahaganden da so trado ada da hya da no kon yada ti ado kon hikeni hinna di nije na ol degi asa de mil yaj doba tradin doba tsebi enel e kon hikeni hinna da jitten but so dilzen kon dan lenigi ashronde hit schnido kodobaka nature kon ben das stil be j das stil but so dilzen beka nature ashant da bidi no hot asa jo hot ein hiyada ho adnani tlini al ka nature no na antin hije kodalia kani masani he cheni nale kina do na ai dan lena khoda no sani hije kodalia so shido okot anni digi ko shaga ni tegi na ga ni tegi shna bel vice president lizer ein antina ko be yeltke do on hin antin eda ni masani he chen hin nale ni ke dan lenigi Ebene antinigi kon be yeltje. Latashin oyo hashkejin halon yada tiente. Jogot ela kon hanen hije kodalia. Alo ben hit dan hit zil do lel. Shi yaje we dan hit do ni. Shi edo sidna. Daisonolt sagi. Ado dido kon ze di naslnigi bikij na anneshigi COVID-19 di de kosentragi na hast AIDS atta naslnigi ze bahazli do kade kon ze nihije kodalia la tse ya tse bedin do ma ashla do bela nihinda khaygi kota an khada tse to le no kade hastra Hastratin doba ashla. Bala. Dog ad ya la kon zel indas na lo shlatin doba ashla. Bala. Binda khaygi ya kon bada atse. Ado nihik nihidin kon bits bichin da hast ya bada hayanigi. Nilzel ene yikidadez ingin le haganden da hast khanigi edo bada atsetole dan zenigi jutla shedo da insen da shedo shado atsetta la dan eshi o nihin khasalla akon den heda di no ya aro beda altseden da di ne jo zet aro benachti di bichdi kha yego kon naslnegi kon hik enigheden beda dolna ot ebenina kodo shido sha ot nihinal bininagi e arobedaltsede naka dot sechukon la zel in ani hini hike hidne dene dan linigi zel in dazli ze de ka kad bananish dekle aje zel inje aje dal nishigi e ado ape dan naka da dot se da no jo yego da iltra ze زين دي كاجدو زيل إندا دو الليلي جو وات إيا بالبيدا هزن جو أي بني ناشدو كدو عشان كوشا دو تستيني بني ناجي جو كدو نيكي جو با دا يوكيد كون زيل إندا لنيجي آني خيني خدنا أي بني نا أي كون عشان دا دي نو بيلتكي عشان نخادا دو تسي كدوني هيك كل ياجين لي واشنطن ده يا زين هيك كدال ياجي سبتين دو بقى ناست اي سوستدين دو بقى تبي تميل يجدو بقى شلا نزدين دو بقى نادين انلت او اي كوني هيك كل يا زيل ان دازنلو كون كون لابج كداليا لاشين خادا است اكو بعد استسيجي يا اي يا اشلدين دوبا هستخان ميلياج دوبا تسبي نزنتين دوبا دزدين دوبا هستخان الت اي كون بعد است يك اني هدنا لي واشنطن زي ان هيج كدالنا اد موغ ده آرو ای بنچه کن زیل این دان لنگی نخال چنی هیک ای دان لنگی یکا نت جاگی بلگان آجن دال نشگی یگو بنا نشد یلا دو ادیله باخه نتزن آشخونده او آشی نی بین گو تخت چده زینت لیا چده کنت ایو لاتشی یاد الله خوینتزن دو تسخينش ده نودا آدو كدو اي اوني كجوبا ديني كير اشخون آدو ده نن اشي نخاه دول جشوت الا شي كون انين ده خيغي نكي دو وط يدالتي هاشي شا دو تس نكي مسان نكي تشين نكي نالي ايلتس اني لتكو بكا ديجا جو كون اتجد دنگي يا كون باهوش نگي الله دميل يجدو بقى تخدين دو بقى تسبي إن الأيقوني كأني كدنا بدني كتسا تجدن بان دي كون الله نزد دين أو الله دميل يجد تشتنجيا استا دات إيا هستخا نزد دين خنا لا إي نيجي مسا نيجي تشيني ناس تازلينجي اي كون دا جدا اي بنينا نيجي مسا نيجي تشيني ناس تازلينجي اي التسبا دا دوتس دا دي نو كون بيلت كون لا الشن منين دا كريجي دا نش نيكشا جو نيجي كون لي واشنطن هن نيجي كدا لياجي غدا دا دوسلي نيجي جو اي بناتش كون ادا إلنا بعد أتسهجي نيجي مسا نيجي تشيدو نيجي كأي نيجي دنا بج عندها بتقيس بج عندها تيجي أيدو كدو تي كون كويتش نيجي كأي نيجي نانا خالشن ندال نشيا لينا اليهو بهاغند ندال نش كوندو دنبي كي يبقاو دا النش جو إن لي قد خدكات الله هندا أدلي جون لي لان دنن دا خيد إي بنينا إي دو ألتسه بعد دو ألتسه تدي نو غد ساد هدا دليادو نالتسوس بكا داليا بدا ألتخا أجيشي دو جو قد نخالتشن غندن دهاز تخادو آده دا ألتخا هاشي ألتخا دو نيل نو بايداتي دي آج بدا ألتخا أجي إيدو بعد دوتس ده نو ahot binda an shot eshikero shna jo joba na do aden do ashwande dadi no ashwande kodo nikikeni hinna bada huilia jo ado nkhada atsagoya nkhada aztsago di ahandi chodal ashwande nike mask adadi nene ay ahot edo les aro yidigol yadaltje tkhalawash yila betrada kis nene ahagan da sotra eye ahandi naso ahot nihina nishnada di nil ashwande jo ahandi nasni ho ta kon de nebike yapaka so ahot shikedo shidna the more gonna the more Sunday gonna shin la kon di bindal kidigi di jos football de snigi Super Bowl de snigi shin dot la kon hik eni hinna da banal dole kon banda huilne ashwande bilkeda hot enigi de ya aslahan tahtle hey le hade shin hik eni hinna keda hat enigi ai binti ade yil keda hat enigi yil aslahan tahtle juk adi Super Bowl hat ne hoya anilsko eni tlinigi kisni tlinigi aslahan deitle do dan ich naslende kodobaso tki ashwande di nana khagi jun next year she she yat eto lek di khagi bi ashwande aro lahandatle dan ich nashi do lel o konde bel keda hot enigi de ya ashwande jedi de nebike ya baka ashon ya andes kidi naslnigi jukodo nihich ashane anali nal sos bakao di kwene la ya bedatolna aslache judi sebetin enelt aslache bedatolna dana do di jinje na kid mo da do tagon le na kinezna tin tradin da na kinezna tin do tra nezna tin da enelt onal kinde kadashon ya konil dana da shen ya sebetin da shen ya enelt alaje bedatolna donana tiche en hiedat eshik enotlini ilka natja do kodosa ni hije kondal iho da isonolts do ashon ahaganen da sotra kodo ani do peso chdet aya o khani kyunle post office den de krigat di shinal so peso gin checks that egi shich kodo nila no nlego bada hanne o khani kyu post office den de krigat no da bana hanne aron le ot di nalihabahan das nelo da nalihabahan tsagin das nelgi de o khiyidnek da ilni da no da obasot ke kodo ashkone yego de deskit alla ndezden da ya ein hilbersen jo beninashi lahande itlehonle keshmish yajdo keshmish de deskit dendel kyo ya do dagonantla ya kweneil iho di na di luodo ya do tsit do leshik enotlini benina da halnya do kodosa ni hije kondal ingi do bada holne ashkode shik shidne aro kwado ni beshbahas anbelasi lin al sos behas an ni hije bekail ya shna bel vice president lizer chiditso chidinat chiditso do tractors that egia do chidnat dashina the graders that egi backhoes that agi hot besa bala as lint only tra naznele de hadas zoja ajnat aynan nigi ba besa bici kodalia hot shide so dat agi shi inte hidol nahi de cho indo le ashladin do ba tin de mil sohnelt beso hot bela da sitli tkodo nas kodo ni chok di le Washington beso chdet anaya de kuishi alla start that jo alla nezatin do ba lahnelt koni hik eni hinne betro be da tende besle chi do be da tende do yide go trona no da alla do na kitsen satranza besle chi do yide go keda hat do electricity be da halonigi kon bekai je kad ya electricity be da hasli do trok at bil ya da Ainley Washington den hika all wadota alla kon di nihik eni hinne yedego water line electricity line da beda halon do bil ya da stita ado tsko de lia do trapeso babaja alia di ashladin do ba di de milso de shnita bahshnegi tra naznele yilindal nesho nal sos heti hadat di lai nihiche kodal ya jo bela da asli ara wide ruins jadok keda hat inigiya kintiel dashin holya o dizdin doba hastra aje kinendaz neligi do trobiche kodal ne dolle jo do trapkrane tsai ahado koje do trola kon hik edi ne biche kodal ne no nal so sada dalia di nal so sigi kotab ka trob dalia in hiche kodalia peso aje ndo nali hot ya di project gi start dal net do lesa no sai da nishido she chitko aten ako nal so sigi aten don da baka dan letra nazna hadas soja kudo ashronde nikitra nazna bislin dalnish nal so sada do le aro benach kujin hije kudo nilto atsko dalia atsko das kao Kiyata joba hozena jo kut ya besa bando neslo atskilo kon di projects that egi that dol waloda le Washington that need not ani adel yagi ya do person hije kodol ni tkonas kodol ni no yandat binina ashta da dolne nal sos beka dalle Nihi chapters biche kodalle ashron ta khojit ego do o shahat nida kon hanne nihi che kondal shisha da noda nal soshe hadat o sako ara saadane ten do shika nal wata da noda yadatke nal sos beka da sa tra nazan biche kodal jo need konla tra nazan ba ga ni te nat aidan lenigia anni digishin hat agi kanas ko don ni lot hadaino nido kodon hikeni hinab ka nacha tlashini himasani hicheni nala asahan da haztra do ka nacha nal sos bahata dohle le ha de shinke da hot enigi ni hido do nihido kodo hanne nihiche kushle tole nihi masana nihi cheni nal nasta zlingi bada holya bahata dohle do only Washington nihi Washington has ajibich tada ita baka nacha Lego tradition ani Lego sheep spring on saya. Ko amasan et she nasta zlinigi azebich kodelia. Asahan dahast kha bajo ba an dahast haida niya. Haida nin kodo shalchin hadin late o the keda hat do they da no da yada don den shichin dahalne da no bajo ba an dahast aron shi kodo o kodo hadaino ne dishno ko sad which could be yashtye arabada azts arach yanda kombiche kodelia naha alchinen nollinigi tsoken nollinigi ke nollinigi so ebini na a hiehe shi dabadi nido lelko nihik enige na ajen dal neshigi ashronde ba hienosson ba hienosson. Let me transition to English real quick and go ahead and put the slide up. If you see the numbers, you know, we bring this up every meeting, give you an update. This is just letting you know the numbers. And that's what you ask for at the beginning, to know what the numbers are in our communities, in our service unit areas. So 28,544 confirmed cases, 14,714 have recovered, 1,038 have lost their lives to COVID-19. Our thoughts and prayers go out to our relatives. As you can see within 24 hours, 70 new cases in one day. And so you're seeing the downward trend now. And I want you all to recognize this is your hard work in following the protocols that are in place and getting your vaccination. And I thank you for that. And if you go to the next slide, it shows you the progression, and you can see at the far right of the slide, that's where we're at right now. You can see we went over the rise in cases, the second surge, and now we're going down. It is very difficult, ladies and gentlemen, to bring these numbers down. You know why we know that? Because we went through 2 waves now. And we can't afford to get uncontrollable spreads in our community anymore, because it's hard to bring these numbers down, because this virus is so contagious. It looks like, we should be celebrating that our numbers are way down, but don't let up. Don't let up. We reopen the weekends. It's because we want to get more people vaccinated. One healthcare facility on Saturday, Gallup Indian Medical Center at UNM Gallup campus, vaccinated over 1,000 people. That's just one facility. Sunday, I went over to Tseotsoi Medical Center with the vice president. Over 1,000 people got vaccinated. So on the weekends, we can vaccinate a lot more people. Monday through Friday, our healthcare professionals are doing their very best. They're caring for their patients, non-COVID patients. They're also caring for their COVID patients. They're giving testing. They're giving vaccines from Monday to Friday. Now we reopen the weekend. 7 days. We want to vaccinate as many people as we can. But stay strong. Stay here on Navajo. You know, I was saying this in Navajo, we heard stories of Walmart being overwhelmed, off the nation being overwhelmed at these stores because of the checks that are coming in to our people. You know, we need you to be responsible, right? meaning that take care of yourself. Be aware of your surroundings. We have long lines at the banks. See, what we're trying to do is keep the large gatherings at a minimum so that we don't end up having a bigger spike. Like I said, once we get a bigger spike, it's going to be hard to get it under control. And we know that now with these 2 waves that we've had. So please share this information with the Navajo people, everyone around us. This weekend is Super Bowl Sunday. Super Bowl Sunday is a time of gatherings, family gatherings. But let me just say that let's not have gatherings of individuals from outside your immediate family, those that you live with. You know, now's not the time to come together and have barbecues and watch the game, especially if you don't know the person where they've been. But those that are living in the household, you can continue to do that. Ladies and gentlemen, you saw the uptick in Thanksgiving and Christmas and New Year's. We don't need another spike from the Super Bowl weekend. And I plead with you, ladies and gentlemen, plead with you. And in terms of the vaccination, we have received 78,520 doses from the federal government. We have put 56,846 into the arms of our family members. That's 72%. Remember, the other day was 80% because we received more doses. And we are doing our very best to get as many people based on the tier approach, 1A, 1B, 1C, vaccinated. So please be patient. And please be patient and thank the healthcare workers. Don't get after them. I saw a lot of these comments on there. They already show you and tell you what group is being vaccinated. And if you're watching this today, you have internet capability. So look at the Facebook, social media pages, the websites of these healthcare facilities. Because if you're not in these categories, you will get turned away, and that's when you get upset. 75 years and over, 65 years and over is where we're at now. Some healthcare facilities are going 55 years and older. And the reason for that is because our elderlies are in the most vulnerable population category, including our high-risk patients. I gave you the number of people who have passed from COVID, 1,038. Over 60% of the 1,038 have been our elders. And we respect our elders and we want them to get their vaccine. Yes, there are incidents that we possibly missed them. There are, it's never a perfect system out there. But we ask that the people bear with our healthcare facilities. And if you don't want to wait in a line, then you have the ability to make an appointment during the weekdays. They're taking appointments. 72% thus far. And I also want to acknowledge that we have had the administration, the current administration, sign off on the major disaster declaration for the Navajo Nation. And what this does is it helps bring in resources to the Navajo Nation. It brings in manpower so that we can get more people vaccinated. This weekend alone, I was told there was over 300 personnel to help out with the vaccination site. So that will bring in much needed personnel and also mobile vaccination units where they can go away from the hospital. The reason why it's close to the hospital is Moderna and Pfizer, these vaccines have to be in a cold storage. And as we get mobile vaccines, we can go out to chapters, out there into chapters. I know Moderna, you don't have to have that really cold temperature, and some of that has been going to some of the chapters in rural places. Like yesterday, I visited an elderly family, a couple who got their second dose. And I was there with them, and we talked and, really just had an interesting discussion with them. One of the things that one of them said was, our children are living way off in the rural areas. I mean, the cities and all, metropolitan areas. And, they're staying there and they haven't come home. We're telling them to stay home, stay over there, and not come here on the Navajo Nation. See, that's leadership right there by Grandma and Grandpa. Putting her foot down and saying that you're not coming into this house, you're not coming home because we don't know what you're doing out there. And that's what is needed throughout these trying times, is to put our foot down and take control of our homes. And let our people know that now is not the time to visit. Once we get past this pandemic, we can begin to come back together as a family. That's just a small sacrifice right at this point, to where we just stay home and help our elderlies out during these difficult times. The next PowerPoint, or this next slide, again shows you a progression throughout the time of COVID from September to January. Is it this one? And as you can see, right around Labor Day, it took off. This should show you how difficult it is to bring the numbers down, ladies and gentlemen. We had to reinstate the curfew, shelter at home. And as you see that, once we got the shelter in place back, it going up a little bit, but we started to see the flattening of the curve there maybe started like right around mid-November. That flatness stayed flat all the way into mid-December. And then, of course, you had Thanksgiving, Christmas, New Year's, and you see a bump there, holiday bump. But we managed to bring the curve back down. And that's you, Navajo people. I commend you for putting your foot down and just following through the protocols. And we got to continue to do that. We don't need to see another bump again from the Super Bowl weekend. Please continue to stay diligent, continue to stay the course. If you go to the next slide, the comparison here between the United States and the Navajo Nation. The orange and the dark blue there. And as you can see, for the U.S., you have 3 humps there. That means there's 3 waves. Navajo, 2 waves. But you can see a little hump towards the end after New Year's, and that's because of the holiday increase from Thanksgiving, Christmas, and New Year's. But overall, it looks like the trend is the U.S. and the Navajo Nation are starting to go down. If you compare it now, you can see Navajo is getting at a low point. And it is to be celebrated, but also it is to remind each other that we are not out of this pandemic yet. Let's stay the course, ladies and gentlemen. We ask you, we beg you. We know we can get through this. We're doing as much as we can with the vaccinations. The goal here in the month of February, I'd like to see 100,000 of our Navajo people total get vaccinated. We're at 54,000 now, 56,000 now. For the whole month, the goal is to get 100,000 shots to our Navajo people, and that includes the second shots for some. And we are giving out second shots right now to many of our citizens. So let's stay the course. Take care of yourself, everyone. God bless you. And please continue to pray for those that have lost, the families that have lost their lives to COVID-19 and those that are struggling right now. And we pray for Albert Hale's family. I just got a message right now. Our president will be taken through Clagato to Ganado, where he was born, around 1 p.m. today. So we'll be going out there to accompany him coming back from Phoenix. We lost a great leader he was my brother clan-wise. Learned a lot from him during my early days as a leader. And we just need to remember that COVID-19 is real. There are other people out there that saying that C-19 is just not real or a joke, or they're not taking it serious. It's just real. And it doesn't matter who we are. This virus is sneaky. It doesn't matter if you're Democrat, Republican, elder, or youth, or what you believe, a leader or not. We just need to continue to do the course. And let's also remember, like Albert, being on the front lines, my brother, throughout this pandemic, telling people out there, listen, listen, listen. These are the warriors that we have, and we will always remember our leaders and our warriors for doing their very best for their people. And that's what my brother did, President, Senator, Representative Hale. And we acknowledge his heroic efforts during this COVID-19. And we just continue to remember and remind ourselves of his contributions to the great Navajo nation. Not just Navajo, the state of Arizona and this country of ours. And we will miss him. I will miss him. So let's continue to pray for his family through these difficult times, and the rest of the 1,000 plus those families who've lost loved ones. God bless you, and God bless our great Navajo nation. I'm going to turn the time over to our Vice President, Myron Leiser. Thank you.
Thank you, Mr. President. Appreciate your leadership. And yes, our prayers go out to our leader, former leader, President Hale, and to the Hale family and extended family. So thank you for your updates, sir, Mr. President, and your kind words there and your remembrance. So appreciate all of our nation's prayers for the family at this time as well. If we could all just shower them with our love and pray for grace and mercy and favor from our Creator for the family at this time. Also to our healthcare workers, all out there. I mean, it can't be overstated how much we care and appreciate and love you all for the commitment and the sacrifice that you all have and are continuing to do in this fight against this COVID-19 virus. So much love, kudos out to all of you. I routinely chime in with some of you all out there and would look to continue to do so. So again, much love from the Office of the President and Vice President. Continually prayers are said for one, and prayers are said for all. So as you know, we're all in this together, and appreciate your fight, your steadfast fight for the nation's life and our well-being. So yeah, love from the bottom of our heart. Thank you, healthcare workers. As I always do, is give updates from the surrounding states, and the president has done a very great and eloquent job of highlighting the need to continue to be vigilant, to stay home, stay safe, save lives. Numbers here, our health professionals will be given numbers on Navajo, the latest updates and whatnot. And I don't wish to be redundant from President's word, but again, I don't think we can, as leaders, mention anything. Our narrative needs to be exaggerated so that we affect the people out there that and then you all too that are viewing this. You can also be a sage within your community that others look to. And maybe you've never been, active or a voice in your community. What a great time to activate yourself and to become a leader yourself, a leader, and just care for the community members in your family as you always do. I know. So again, we're all in this together. So numbers in Arizona, total positive cases, 771, 796. And I mentioned just for the fact that, those of you who are traveling out there, this president said a real virus. And, there's many holdings, there's many opinions out there, and there's many methods, but we have the authority here as leaders of the Navajo Nation to be doing what we're doing, and we are backed up by sound and definite data and information from our health professionals. And, again, you'll be hearing from them here real shortly. So total deaths in Arizona, 13,752. The new cases, 4,417. This, of course, is statewide, with 176 new deaths to report in Arizona. Apache County doing a deep dive, a deeper drill down in the numbers of Arizona today. Total positive cases within Apache County, 9,724, with total deaths at 322. 40 new cases to speak of in Apache County, and with 5 new additional deaths to report. Navajo County, 14,713, with total deaths 448, with 68 new cases to report as of yesterday, with 2 new additional deaths. Coconino County, rounding out the counties within Arizona, in the northeast corner of Arizona here on the Navajo Nation, 15,419, with total deaths 285, new cases 43, and new deaths to report 3. So that's the rounding out Arizona portion. New Mexico, 175,652, with total deaths to report in the state since last March, 3,338 deaths to report, with 670 new cases of COVID-19 positives and 29 new deaths. And again, this is statewide in New Mexico. San Juan County, 13,072 total positive cases, with 47 new cases to report. Total deaths are 389. And we appreciate these numbers given by my staff, Mr. Adam Begay, who does all of the research and whatnot. So I appreciate that. Gallup-McKinley County, 11,638 total positive cases since the onset, with 51 new cases to report, with 417 total deaths here to report. Rounding out the states that surround the Navajo Nation, Utah, our northern state up there, total positive cases 350,000, with total deaths to report 1,697. San Juan County in the southeastern portion of Utah, total positive cases 1,762, with 36 deaths to report. Our own Navajo Nation in the Utah Navajo health systems, their total positive cases is 1,043. Real quick update here. We've been doing a lot, as you heard, President. We are traveling. We are taking in and visiting the vaccine drive sites in various regions, various places. We last week we were in Shiprock, and the Northern Navajo Agency there is, been experiencing some surges, just like most of the Navajo Nation. They have focused on the elders and the first responders, and many have received their second doses of the COVID-19 vaccine, whether they be Pfizer or Moderna. But these on day one up there in the Northern Agency, day one of this latest vaccine drive, 937 of our citizens had received. Day two, 569 citizens did receive the shot, and day three, which was the day that we were up there, 390 of our Northern Navajo citizens received the shot. In the Northern Agency, in those community clinics, 1,896 have received a shot. So they're averaging 200 to 225 shots at the drive-up section there at the Northern Navajo Medical Center. So a big shout out to our Northern Navajo Medical Center and all of the health professionals there, everybody that's contributing, working hard. We did greet just about everyone there, security, those organizing, those directing traffic, and also the ones administering the vaccines. It's such a needed protocol and stringent protocol that they have to endure and practice to get all of these vaccines into the arms of our citizens safely. So we appreciate them. A lot of planning, a lot of collaboration, and a lot of commitment to the work in which they're involved in out there. So again, I can't overemphasize how much we appreciate it, and even going to these spots and just thanking them. And attaboys, attagirls, thanks a million, all those things, they're in line for all of them, our health professionals, so we appreciate them. A special shout out to Coach Gabe Smart up there for providing the tour and the assistance when we were there during our visit. And also, again, the staff that was there, many of them just working hard, diligently, and again, sacrificing. And their commitment to rolling out this vaccine has been very efficient and has been highly proficient. So they're doing a great job out there. So we appreciate that. This week here, yesterday, we actually had a meeting with Senator Mitt Romney of Utah. And it was a great meeting, touched on a lot of subjects. Namely, he's very interested in working with the Navajo Nation to help revive our tourism, our economy. And as you know, we have the shared parks there on Monument Valley, which lead and give access to the Canyonlands region, up to Bears Ears, up on those areas. And so we touched all on those subjects here. So Senator Romney will be a great advocate for the Navajo Nation and a partner, which he's already done in this new Congress. He yesterday also revealed that he is working along with our own senator, Senator Kirsten Sinema with Arizona, a true bipartisan approach to bringing about legislation. And so we applaud Mitt Romney and Senator Sinema of reintroducing legislation to support the Navajo Nation during the COVID-19 pandemic. This particular legislation would invest $1.3 billion in strengthening the sanitation facilities construction program to support water and sanitation projects for tribal communities. Well, that would be a boon. That would be a boon. And so these are those areas that lack of water infrastructure and sanitation, and it would address this issue by authorizing the construction and renovation of water and sewer sanitation facilities in Native communities. So our prayers for that, support. We support it, obviously, and we hope that many would sign on and offer their bipartisan support for that as well. So kudos to, again, Senator Mitt Romney, who we visited with yesterday. And we talked about advancing some of our initiatives. Even talked about the highway between Oljeto and Navajo Mountain. As you know, it takes almost 2 hours to go round trip. And wouldn't it be great if there's a highway that goes right in between as the crow flies, probably cut the time in half, maybe. So again, appreciate his leadership on that, Senator Romney. So yesterday we had a chance to meet with him and look forward to future opportunities to meet with the senator as well. So I appreciate that. And just today, this morning, we also received an update from Mr. Chuck Hemphill, the founder, the owner of CKP, or at least the manager now. I think he sold the company or was bought out, but still doing a great job. This morning, we were part of a check presentation to our Navajo Nation. $21,074,993 check presentation was given to the Navajo Nation. This is the drought mitigation insurance that was legislated about 4 years ago. So what a great program. In 4 years, that program has paid to the nation because we are in a drought, and it does try to mitigate drought, and it affords the nation money that would help us fight this drought situation, emergency drought, and be able to provide money for agriculture programs and new things. So I really want to take this up with the our 24th Navajo Nation Council. Well, let's provision a lot of some of this money. Again, in 4 years, it's paid $71 million to the nation in money and funding. So what are we doing with it? Well, we want to work with our 24th Navajo Nation Council to develop a plan. Let's develop a plan where we could start showing some fruit from that. And I know they've used the money for various projects in the past, enhancing and building and strengthening our earthen dams, buying equipment for that and all that. But maybe even being strategic and let's look at agricultural projects as far as are we looking at drip systems, hydroponic systems, growing self-sustaining projects here, which will feed into the nation, especially during a pandemic, right? What if we grew our own food? I've seen these things and we're studying them. We've had a couple of meetings now on hydroponic systems. Again, developing these large self-containing, self-sustaining, I don't know, I'll call it a community, but where we hire Navajo workers, they come in and we build this thing and we start growing food. We start growing our own fertilizer, and it self-contains. Any waste is burned up, used as energy. We create our own energy. Again, we use Navajo workers to do this and pay them, some good money to learn how to do this. And so the self-contained project here is what we're studying right now. We're having meetings right now as we talk, but wouldn't it be great to use some of this money for a project like that, where we just start making money selling our own produce, our own products, right? Selling even, taking everything. There will be no waste, not any footprint in this here. Creating our own biodiesel fuel, our own clean energy products, and then using it again, creating water. It's just so many things. I'm really excited about it, but obviously I'm excited about a lot of stuff. We are also meeting on our economic recovery work group. So on and on. There are just a lot of great things that are happening, but these are the ones that were just the recent development. Senator Romney and that bill, that legislation that we're looking at. So we'll be expecting to hear more. Also within the Utah, just want to give a shout out to Mike Maurer, the Senior Advisor for Community Outreach and Intergovernmental Affairs in Utah. Within Governor Cox's administration, there is Utah state legislation that'll help, and it's advocating for Westwater, which is a Navajo community in rural Utah, which could eventually receive running water and electricity. State Representative Phil Lyman represented a appropriation request to a committee in the Utah legislature for $500,000 to kick off this 4-phase project. And so the Nez Leiser administration, we support this effort. So on and on. Again, just a lot of things happening, and I wish I could give a longer, drawn out, more information-packed updates for you, but those will be soon coming. And just like we've done, I believe we can list the projects when they come to fruition and do some big rollouts on that, press releases ceremonies and whatnot. So anyway, I think I've taken up more than my time, but we're just working on a lot of things here. So those of you can be updated. The Nez Leiser administration is open, transparent, and reporting these great new initiatives and working with anybody who wishes to work, get down and dirty, and let's just bring a lot of advancement to the Navajo Nation. So again, Vice President Leiser here. I will be introducing next up here, which will be, I believe, Dr. Jim of our Navajo Department of Health. Appreciate her leadership. She's done a great job in working and bringing out and just kind of like President and I, utilizing all of our resources and the fine expertise and knowledge that's at our disposal here within the whole grand scheme of the Navajo Department of Health and the HCOC. And I'm stealing too much of your thunder, Dr. Jim. At this time, I'd like to introduce Dr. Jill Jim, our Executive Director of our Navajo Department of Health. So, Dr. Jim, yeah, for all you do. God bless you.
Yes, thank you, Vice President, for all your kind words and reminders of all the things that are happening. I guess in this new world, we have, we're stuck to our computers every day and our TV to get the latest updates. A lot of social distancing plays a big role in what we do, and we're just adjusting as we go. But thank you for all your updates, Vice President. And then President Nez as well, thank you for your updates regarding COVID-19. And today I just want to share some information with everyone. I'm the Executive Director for the Department of Health, and I am, I'll say my clans, look on the Sean Kachini Bashashin do Ishin do Shichedo Izofana Edashanala Ada not this Ada Aisina Shado. It's East Bahian Jabik Edinshi, and I just want to do a quick reminder. Kachebila Gana de Aja Adesta so Kihatnon. So thank you for the listeners for being on the call. And as President mentioned, we try to do messaging out. We do have an email listserv if individuals are interested on our Department of Health webpage, and you get regular reminders. And the reminder that was sent today from the Public Information Officer team, which consists of a lot of our 638 and Indian Health Service and our tribal staff. We are a unified group in responding to the pandemic, so I just always appreciate some of these messaging. And around Super Bowl, we enjoy that every single year. A lot of things that we have emphasized is just to continue not gathering as much as possible. So right now, large gatherings, especially with separate households, are not allowed on the Navajo Nation. And so gather virtually if you're able to do a virtual Super Bowl party, wearing team jerseys and decorate your home with your team colors, make appetizers or snacks with the people you live with, share recipes, start a text group with other fans, or just some reminders. And then especially avoiding large gatherings. We know that those also play a large factor in transmission of COVID-19 if you are gathering, especially if you're gathering not safely, even though you have family members that might live next door or down the way, a mile or two away from your household, and they live in a different home. The exposure of COVID-19 doesn't distinct who all lives and who we consider safely. So it's always best to just think of everyone that comes into your home as possibly you're putting yourself and your family at risk, and that's why it's always important to avoid gatherings and making sure we continue to protect our elders and our family members. We are still experiencing a lot of our relatives passing from COVID. So just to let you know, it is a disease that's very detrimental, and I think that's the reality of this disease. And so I just want to encourage all our relatives, just really be careful. It's no time to let down this weekend. to say that it's okay one time to just get family together. Please wear your mask if you end up in that situation. Do not gather as much as you can. Wash your hands when you're in your home, wherever you go. Avoid sharing food with people you don't live with, and trying to complete things virtually too. So that's very important. So some of the messaging that's done every single day is to always wear your mask, social distance wherever you're at, wash your hand and clean as often as you can wherever you're at. And this is a CDC recommendation as well, Safer Ways to Enjoy Super Bowl. They do have similar recommendations as we indicated here, adopting their recommendation to making sure that you don't gather as much as you can. And people will end up gathering, but we're not in a place where people can gather outdoors. It's pretty cold here on the northern Arizona of the Navajo Nation and everywhere. So I don't think you'll see people celebrating Super Bowl outside watching TV. So everything is still indoors. So that's why we ask everyone to take all the precautions. Always continue to stay home and not go to work or go anywhere when you're awaiting for test results. And if you're experiencing symptoms, it's just as important to stay home and making sure that you don't share any items with your family members, or either share rooms. So you can make sure that you find a separate room and a separate bathroom. We still have isolation hotels in Tuba City and Farmington for Chippewa residents, and areas around Tuba City and Chinle. We still have a congregate isolation area that you can get a referral through your healthcare provider, and then you can also still request for food assistance if you end up having COVID-19 and you want food. So work with your case managers or your public health nurses at the health facilities to get resources for you. And so those are just some quick reminders. Workplace safety, as employees are going to return to work very soon, and making sure that even on your first day, if you're sick, please don't come to work at all. And even though if you think it's an allergy, if it's like a flu-like illness, please stay home. It's really unknown on what you might have. It could be an allergy, it could be COVID, and you will know if you have been exposed to someone that's positive. It's best to just stay home when you come back to work, or anybody. And also, reporting exposures are very important as well. Continue to report exposures either as customers or either employees, so that way we work with health facilities to ensure that a case manager reaches out to you to get your results for testing, or either getting people tested and getting people isolated and quarantined as well. And also continue to understand that we are following the prioritization of the Navajo Nation COVID-19, which has phase 1A, 1B, and 1C. We will be in 1B for a while, but every facility is different depending on the size of their facility. Clinics in some areas will be reaching other populations like businesses and infrastructure sooner than before. They're all coordinating slightly differently, communicating with entities or organizations in their communities, but just be patient, and we do have a registry that you can sign up on, and we can assist you with notifications and getting vaccinated. So just be patient. I know that we encourage everyone to be patient, but we're focusing on getting high risk and our elders vaccinated first, followed by other essential workers, spiritual leaders as well. And also know that when you do get your shot, it doesn't take an immediate effect. You have to wait a couple of days, and even after your second shot. And then also to still continue to take precautions. Yesterday, the new CDC director did indicate that these new variants could be deadly. And once you hear a federal official say that, I think there needs to be some caution that we all need to take. And that doesn't mean we need to let down. So ensure that you continue to wear your mask, because the new variants are very unknown on how they can actually quickly occur. And while we know to some extent it is easily more transmittable, So I guess what I'm saying is that with that fact, I guess we can ensure that we all take the precautions. And so right now our numbers are going on a downward trajectory, which is good, but it's really up to us to make sure that those numbers remain low as well. And this is the registry website to do an online registry just to stay safe. And at home is also one recommendation that we continue to stay the safest places at home. So seek essential services. It doesn't mean that when we lift the weekend lockdown that that you do unnecessary travel and errands. Everything is related to essential services, getting food, checking the post office, getting gas. Those are all essential needs. But if there's non-essential travel that you're doing, yeah, please consider twice, even though we're asking a lot all the time of you guys. And I think we lived through this, and this is the new norm. Finding ways to do, instead of doing multiple trips, do one trip and grocery shop for 1 week, not going there all the time, every single day. Or I think the individuals that I'm referring to is sometimes the one where we live near a grocery store. But if you don't live near a grocery store, I'm pretty sure you're already planned in that matter. So just continue to take all the precautions that you need to, and we gave some advice on all of that. And so I just want to give over time to Mr. Hazel Mella from New Mexico Department of Health and Human Services, and then to Ray with New Mexico COVID Crisis Counseling as well. So everyone stay safe, and thank you for listening. So I'll hand over time to New Mexico Department of Human Services. Thank you.
Thank you, folks. Good morning. Magandang umaga sa inyong lahat. Salamat sa invitasyon. That's Filipino. President Nez, Vice President Leiser, and colleagues, my sincerest gratitude to you all for allowing us to present to you regarding the New Mexico FEMA COVID Crisis Counseling Project. Dr. Jim, thank you for the introduction. My name is Dr. Hazel Melia. I'm a staff manager with the Behavioral Health Services Division and the project lead for the New Mexico FEMA Crisis Counseling Services Grant. So I've had the privilege of being part of a very committed group of individuals under the leadership of Dr. Scrace and Dr. Neil Bowen. I do want to give a special thanks to Mr. Chris Bahi and Mr. Ray Daw for inviting me to this meeting, and to our FEMA and SAMHSA partners for giving us the opportunity to share and extend needed services and or resources to our Native communities during these challenging times. And to all of you for the tremendous work you do. So just a brief background about the FEMA Crisis Counseling Grant. FEMA approved and awarded New Mexico a CCP, or Crisis Counseling Immediate Services Program, ISP grant in April for 60 days. But because of the COVID extension, we were extended twice on this, and it ended October 29th of 2020. When the grant ended, our New Mexico crisis counselors were able to provide crisis support services to 6,401 survivors. Since receiving the Regular Services Program, or RSP grant, October 30th, to continue the work of our crisis counseling services, our crisis counselors have been able to reach over 6,233 survivors, most of them Native. The grant provides crisis counseling services to individuals who have been infected, affected, and impacted by COVID. The crisis counselors help to allay the fears and all of their concerns due to COVID. It really is about checking in with individuals during these challenging times. And much like a neighbor or a friend or family member who checks in with each other, it's about high touch. It's self-care. After all, your mental health matters. The crisis counseling services is a preventative measure before it becomes dire, just by contacting a number listed on a flyer. We have Native speakers, specifically Dene speakers, who are assigned to individuals who request for one. In most cases, pre-COVID, during times of disasters, the FEMA workers usually go door to door. However, because of COVID and following CDC guidelines, just like Dr. Jim was mentioning, guidelines of social distancing, free services are currently provided through telehealth services such as iPads, laptops, and/or cell phones. Some highlights to share. We are working closely with two exceptional consultants, Ms. Steph Poston from Poston and Associates from the Sandia Pueblo, and Mr. Raymond Daw from the Navajo Nation. Because of their understanding of our Native communities, we were able to get approval from FEMA to purchase 500 backpacks, which was distributed to our Native homeless. But I will defer that to Mr. Ray Daw to share more about this wonderful initiative after this presentation. We've been able to get toolkits and yard signs that were hand-delivered to our tribal health and wellness centers. We are now working on billboard displays, radio spots. In fact, the radio spots have been heard on the Navajo Nation regarding our initiative, our FEMA initiative. It is about a phone call away to help with outreach and crisis counseling. So a misconception that challenges this outreach efforts is that we are taking away jobs or that we are duplicating efforts that already exist in the Native communities, referencing COVID. However, with the help of both Ms. Poston and Mr. Daw, we hope to dispel that misconception. We hope that through this presentation, to help fill a gap or resources and or services you need, streamline the referral process from the individual to services, leverage technology resources, and collect meaningful data to show evidence of real-time inventory of available resources and wait times for continuous improvement efforts. I appreciate the time, and I will defer to Mr. Daw. Thank you, folks.
Yate pena to di kwai nakaho aigi teacher through the help of our Honorable President Jonathan Nez. Di inshigi Ray Dodd inshido shiki aninshla. Tlazalana bashinchin to Sitna chini da shi chait huda chini da shi nada huda it and then shido my tohada Hawk Arizona adi na sha ado nan George what yagi even na kilnste huda chita sin do le shi do shi den trahasi di de kon shlanja ka zigi enle yo todo ado na nste ado di it's by Hayado and take case by Hayanigi Agilin Dadlish. Hazel or yes, the Agenat Ani Longe Ado Peso. The Hatchon Dajan Dignly your Toby Hearts over. A peso chain, the Gishin Hashil so a the Tlejidan Clinicitlanha, Chatney Nel. Ado a by peso chain, Nelge Ado Pato a Cotext Adonan Stazri, Haleta 80 since Tlijidan Lenigi, your Torge, Ikeda, Dinibicado, what had no she, a Ado Ebaha, Zido e Ado Benache Kodo, Nanishna Hanilia. A Nanishna Hanilia, Gide, Han do Nahat Agi, Betos was Kid, no Ecodope, Kitchen House, Zido Benache Kodo, Nanish. Hanilia. The cousin sa it trans negi anigego bike hichet da doda eda doing a take case it's not na kudona haljon jono ko President Nazga halna beta da haliado beta da haliada kida no ekudon kicha hata atse kodo totally dance Hugo. Ado Vice President Liza from Januya, Zilo Tinley, Nanishin, Linkit, Cushing. As is what Ada, and the Asan Halo, a done resources, isn't die Danishiki jo hildan sto le so e kodo e khita e khan da lo do le so she kodo ya tsik so ya tsi kodo Vice President Lizer in utilizing resources is no ya tsi di kodo ben del nishiki yo todo e kodo resource with niki na nishiki e kodo hashin so e kodo chite di il hun so stoppen ya e hoda the how e pa e kodonni kan sha sa the mod as the e kodai di kan den linki to bahan to jo bahato linki e kodo dati lot enle hazel ya hat si covid crisis counseling services no e kodo ya hat si e hota e na nashinle to e pa e kodo din le beschanne longo e kodo na khalchia e kwati kon kha e kodo hanna do benje ani kebche hanna do jende de to biche ha chorna e ado e shrishi stanat ndat long e kodo e besh be hanna ne de do til ado ne de tranche e shi ado la ko de aki ba tsi kesi gi ba ko ne gi de beche has dots Ebelket nachts na shi ado nache ado hashil so da khutna dolne ado khutna khut belket nachts nagi ben nache ado nana sachota kodo shan ka do was not a dolnis referral this never gonna geshe ado ben nache ishin ba khun nagi but is get ado an tshago ko ka do was chna be Bishop ne be chol now. Ani can do con chol now. She was jiki yo dan show they don't do that. Yo is yata has neda. A namen as they never the gun kesher. They would die a sheep get this thing to ba haya. Would die a bishop ne ya do unfit a net and low the cushions like the a trahendalnish. The Trot hatte do koen an George de Donley beltiste Albuquerque en het net an land sich kligi dan lo ado die peshbe han naike dat is eben na che konjol na do ad nabje dis section so she beten nas dos kill ado she ad nan lenigita bebe has dots die da ad lashetis ado passion na no even 90 pesh nagi as yashike to na ado chudo influence so even yeti ko sign da is tiligi dan hugo da nilsto les di in the na kiskania dan le UNM dan Georgia the UNM branch is no that all trage other that is nil what I dai nilstoles ado tres kanya dainle consular New Mexico and Belgrana snares ashen das nile ado sosan as don't le crown pointers don't le what that all trage the net technical school the sosan das nil what I studied now by the credit science and ligi could answer you shit and das nil in ha elcheta via do le tipe as nigi ben yashike na kodo is go by that city no kodo asho di kwa ikinant an lenige John Honorable President Naz do Vice President Lizer da kodo is on khahot di hit abed nasl show hit ikit nay bakat do was do but and open no she kwa in khaho ashke do dat is so kodo opa chont ango shideya ben yeti an khalchelia ad only Facebook that has ningido Instagram that has ningita eota stobik in nistin le ba negito di die dans Jugo get net dan lenigi the spade houses and all that no e could have been the nicht only post it lenigi upon a crystal. I don't know only hazel ya had get only fish radio stations though I don't behind that. Die could all la COVID and that change not in long the deep in yet has no e the hot KJK do KNDN do even I could quite get done it as is a go quite by his seat or less than ye could on how I should get it and do here do yet it or that ya ni hit it can I ya see it lay it can get a skill take do other yegos and they could go be hot on it so Dr. Jill John, Dr. Jim and then get ya only to list. Yego Yanato, Nile Ado Shinjo, in non linigi yat in the dot, Leton Hike, Dojo, Yego, Hiket Hita on Nito list. When Sin, I non Kitan Letichik 8 Chitna. Do hot I even not a could ask is of Bahasido, a hat in Nito list, honorable president or vice president or could open that should overstand us and yego that into yego Nahanda Ado Ecuador yet ilk and that or Dostanitzen. Yeah, our Kodo has said all this. Yeah.
Mr. Brian Johnson, go ahead.
Okay, good afternoon, or not quite noon. Good morning, everyone. Almost the noon hour. This is Captain Brian Johnson, serve as the deputy or acting deputy area director for the Navajo Area Indian Health Service. I work beside Miss Rosalind So as the area director of the Navajo Nation, with Dr. Loretta Christensen as the chief medical officer of the Navajo area. And I just want to thank you for the time here this morning. I do know that in this conversation today, there has been a lot of information shared already about the numbers of where we are with COVID-19. There's also been information shared about prevention measures and tactics. And we continue to share that information with the public because our primary concern is making sure that we're doing what we can in the healthcare environment and in the public health to make sure that folks are protected and are aware of things that are going on, changes that are taking place, and just again doing what we can to serve the Navajo people. So we continue with the Navajo Area IHS. We continue to work daily with the Navajo Nation Department of Health and also with the Health Command Operations Center. You know, that's something that has gone on since last March or so, and it's been a tremendous effort and a collective experience in terms of fighting this pandemic that we continue to fight. And I want to thank the public because the public has made such a substantial impact by following the information, the guidance by local health professionals, by President Nez, by council delegates. Just sharing information and following that leadership has tremendously helped our situation here on the Navajo Nation. And we continue to work with other partners as well. The states of New Mexico and Arizona and Utah. We do, whether we're talking about the Navajo Area Indian Health Service or the Navajo Nation, there is constant conversation, making sure that we're sharing resources, sharing information of any new developments. And so it's been, again, although it's been a difficult and complex time over the last year, it's really been a great experience in terms of working with professionals across the board. In addition to that, with the Navajo Area Indian Health Service, we continue to have frequent phone calls, conference calls with our IHS headquarters in Rockville, Maryland. So, the Indian Health Service nationally has 12 area offices, and we have the opportunity to work as a network. So while we serve here on the Navajo Nation, we're also interested in what's going on at the national level, understanding how other tribes are being impacted, the experiences, the challenges that they're having, and how do we best support each other. And so that has been a very consistent effort where we're sharing information up. And then since our headquarters office is located in Rockville, Maryland, which is just outside of Washington, D.C., we're able to get real-time information about changes that are going on, opportunities that are coming up, funding sources, and those kind of items. I just wanted to mention that at this phase of the pandemic, that the COVID vaccine, of course, COVID-19 vaccine that we've all heard about with Moderna and Pfizer at this point, continue to be a major priority for the Indian Health Service and also for the tribally managed healthcare facilities here on the Navajo Nation. And I think it's important for the public to understand that this is not simply providing vaccine coming in and we simply just set up clinics. There is a whole organized effort in terms of how the vaccine comes in, how it is handled. We communicate between the tribally managed healthcare facilities, the federal healthcare facilities, with the Navajo Nation, of course. And it's common for us to have phone conversations with President Nez and Vice President Nez and Dr. Jill Jim very routinely in the background about the number of vaccine doses coming into the Navajo Nation and how that's working. What are the logistics surrounding that? So we constantly are communicating. And it's really been, again, I think, an outstanding effort in making sure that we're all on the same page of the direction we're headed. I do just want to make a couple of comments when we talk about the vaccine. Of course, if we think about the national picture, there's basically two sources or two channels, if you will, for obtaining the vaccine when one lives in Indian country. And those two channels are either through states or the vaccine is provided through the Indian Health Service. And here on the Navajo Nation, most of the vaccine is actually being routed through the Indian Health Service so that we can and make sure that we have clinics set up so that we're very efficient with our time and energy. Also, for example, the state of Utah does route vaccine, which impacts Utah Navajo health system on the northern edge of the Navajo Nation. So that's a different channel of vaccine that's coming in. But again, we do communicate very broadly on that and making sure that everyone understands what our numbers are. We share those numbers. We share the information about how many vaccinations have been completed. It's very important that we keep a high percentage. Anything that we're receiving in terms of COVID-19 vaccine, that we're getting it out to the public, that there's the highest percentage possible of completed vaccinations. And so that's our goal right now. It's also, I wanted to share some information as it may save some folks some time and maybe prevent some headaches. As we go forward with the COVID-19 clinics and the vaccination clinics, you'll notice, and I'm sure that you've heard, that at each of the healthcare facilities here on the Navajo Nation, whether they're federally managed or tribally managed, there are vaccine clinics that are being set up and established.
And many of those are drive-through clinics, for example. And there's processes, specific processes that are set up to help support that. And I just wanted to make a comment that's important for everyone to understand, and that is, as we're doing these types of vaccinations, we all know that the Navajo Nation did establish vaccination priorities and with different populations here on Navajo Nation. As Dr. Jim alluded to earlier, she spoke about phases 1A, 1B, and 1C. And again, we are all following that particular prioritization of those groups to make sure we, to the extent possible, maintain priorities consistent across the Navajo Nation. Now, in doing this, one of the things when we're setting up clinics, vaccination clinics, say at any one of our health facilities, in some cases there will be health clinics that are for a special targeted population. That might be elders, say 65 or over. And in some cases, those clinics are closed. They're considered to be closed and to only be used by those individuals who have appointments or who have been notified specifically to attend those particular vaccination clinics. And so, for example, if there's a clinic that's set up and it's by appointment only, or it's referred to sometimes as a closed clinic, if you show up just because you heard that there was a health or a COVID-19 vaccine clinic going on, you may be turned away because it was by appointment only. And we don't want that for any of our customers. We want to make sure that when folks arrive, we want that to be a smooth process, just like our customers want. And so please, on any vaccine clinic schedules, please take a look very closely at what the information, how it reads. If it's an open vaccine clinic, and those types of clinics do not require appointments. And so again, they're oftentimes referred to as open to the public, or by no appointment required. Then those are the clinics where everyone basically can show up and choose to show up to which clinic they would like to show up to over time. And so again, we would not turn folks away at the open clinics. But again, we've had some instances for the appointment only clinics where individuals have shown up and we've had to turn people away because we've scheduled the specific amount of vaccine for the patients who have been invited to that specific clinic. So I know it can be a little confusing, but please be sure to read any scheduling that you may see, or contact your local health facility to get specific information so that, again, we don't want to turn anyone away from getting a vaccination, but in some instances, we can't avoid it. I'd also like to just mention that we continue to work with our partners. We've mentioned on several occasions how we're working with the Department of Defense, and specifically here on the Navajo Nation, the Army and Navy have provided specific nursing resources, and also the U.S. Public Health Service has also done that, and we continue to receive support at various health facilities, again, whether they're tribal or federal. And so we continue to monitor that and how our staffing resources are doing. Again, we know that, as was shared with President Nez earlier, and Dr. Jim, I believe, we know the case numbers in terms of new cases are on a downward trajectory. However, we also know that here on the Navajo Nation, we still have a large number of positive cases that were already existed. And so we still have to take those measures to protect ourselves. So we continue to monitor that situation. We want to make sure that we're appropriately staffed so that if we have additional individuals come in to be, whether they're being tested, whether they're coming in for vaccinations, whether they're feeling ill and need to be seen immediately, we want to make sure that we have the staffing in place that really takes care of our patients. And so, again, just know that we're monitoring those situations in the background, and we're still working with our partners on making sure that we have adequate staffing at all of the facilities across Navajo area. The other thing that I'll mention real quick is that in 2021, in January of 2021, Congress did approve funding to be allocated to the Navajo area IHS, and as well as to the national IHS. And we are presently awaiting that funding to be what we refer to as being allocated to our area or provided to our area. And I think it's important to note through the Indian Health Service that those funding dollars that come in, that those do actually get channeled to some parts of the Navajo Nation, to our tribal health organization partners out there who are Public Law 93-638 tribal health organizations, as well as to the federal programs. And so when that money is received at our area office in St. Michael's, our Office of Indian Self-Determination works with our finance department and makes sure that those fundings get distributed as appropriate to all of our partners here on the Navajo Nation. And so that funding goes to support efforts such as the COVID-19 testing. We're continuing that, the vaccinations, contact tracing, and any of our community mitigation efforts that are going on around the Navajo Nation. Basically anything public health wise, those dollars do help support that. So just trying to provide some information for folks who may be interested in how the funding flows down from Rockville, Maryland or Washington, D.C. to the Navajo area. And then we all get involved in trying to get that funding out to all of our partners as quickly as possible. And so with all that said, again, I just want to emphasize that we're all working tremendously hard on getting the vaccinations, the COVID-19 vaccinations completed. We're working hard on strategies. How can we best serve the public? How do we best serve our patients with special needs in getting the vaccinations? So that's something that's a very high priority right now, whether it's a federal healthcare organization or a tribally managed organization. It's a high priority. We want to see high numbers in terms of COVID-19 vaccinations. But I also want to remind everyone that once vaccinated, it doesn't mean that we go back to our old ways of what we knew before COVID-19. We still have to follow the COVID-19 prevention strategies. We've always talked about distancing from one another, wearing a mask, and washing hands. And we're going to continue to preach that message. We need to continue following that. So it's great to be vaccinated, and that does reduce your risk of COVID-19. However, we still need to follow those prevention strategies. And then I'll just say on a final note, I just want to encourage folks, as I'm looking out across out a window right now, that's a sunshiny day. It's a little bit cool, but it is an opportunity for us to step outside of our homes. If you feel like you've been caged up, for example, in your home, I know I feel that way. And it's been a long pandemic, and I do recommend on these nicer winter days that folks get out, get some sunshine, get some vitamin D from the sunlight outside, and get some exercise and just enjoy the outdoors. We've talked oftentimes about COVID fatigue and how we're all tired of this pandemic. And that's just one of those ways of reducing the stress associated with this particular pandemic. So get out there, make an effort, enjoy the fresh air, the clean air, the sunlight, and just enjoy the outdoors to the extent you can, because we know not every day is going to be sunny like today. But with that said, I'll go ahead and turn back to Dr. Fowler at this point. Thank you, everyone.
Mr. Yazzie, did you have anything to add? Marcus Yazzie? Oh, yat eshik edoshne quay inni nashit etchik ado yananat eshik edoshne ako kodo e ya akwijin hichahadeze. Thank you to all the listeners out there. Again, we appreciate all of you that log in on Tuesdays and Thursdays for our town hall. We appreciate each and every one of you. We want to thank all our public health professionals, our medical staffs, our Division of Public Safety, our police officers, EMTs, and on down the line. In addition to that, we have a lot of educators out there, our students, and then also our employees and our many leaders that we have within our Navajo Nation. Again, the personal responsibility, it lays with us as an individual to control the spread of this virus. Nihina ataha il zido nihitne baha il zido jo ahilne shikedo shne ado ti ostoit ini laho ent ol nitli bitsa na apa lini ati nihichiton hize bitni abatata des ba ne nihilla da thala washbet khata kis nle na tin dahil na din skinloy kosi jo hot ada bewol tra ado nihilanj don hiket na guys tra des is nihitra ahuinosen nihitra na chika ahuinosen dan hit na. The community initiatives, I know it impact us all emotionally, mentally, physically, and spiritually. It affected us, our daily work. You know, how can we overcome this pandemic? We were all not prepared for this pandemic. Jokonde Oshihanza Jeta Okadi Zel Ebernaz Anno at Eshik Edo Shitne Ze Bahazli Hatne Hashine La Ze Hichahulia Eshatino Ati de Miliaj Balaho Yilkik at Hichahuliai Kadat Enle Tostino at Tepid is nothing the Miliaj. Jokone la shein nihichahulia ado nihidne en linis tuisani lini ba tahaskane kadle ishlatino ishla Emilia je jokone la naha das kanle ako aslaha de is nothing the meal jokone la den hidne en lini is ba do kat our goal is to get 100,000 of our Navajo people vaccinated. We have received over 78,000 vaccination, and we have administered over 55,000. Na kishi ilchen ka oko hashin soko hina ilta ado ta atan la oko ya ilchen da ke oy ashkonde ne winosen afe shin belta haganit ta hoton na tan hit no ta ben hiche na atke Nakaka sanibini na anhiti nishik edo shidene. Ado di shelter in place aho wadiso taha nini edo kodo ati yego benta ni tkin. Ako di nasko ne je ando ni tati no benta huit adonal sos behatadil ne. O yugo kasanache. Rashi kasanache yen dan hin tkino. Di de kosen sad. Nast eight at tapeti nini. She hot what she done there. Ashin hin satot ba yel ti on hik el tota. Jokwinsen to sata. Okwande ndal di nda annisho nadne hat nini ba yel ti jo edi tsalate nat anin lini sato bahnalia nakahnatasla. Bilganak at your recovery plan, Dishna. Recovery plan is that any hit Nahanda Nashibik it needs eat or le. The safety officer, Dishna, safety monitor the Dishna. Ita dad Nashi Sato Naha Asido Nahik it is each Bikitahotini. Ita Dale Nashiki Ashi in ni Ajito Besos at Panahot Closing de. Jokwaek na iste do het ana anishta asha ninda nishe bichinto bezeta that is par jo ne kahido kwa sho he niniki jo la biketa dilni aftishne akko ado ani hisi zi ani hi nikina antien kwallo shik edo shidne Kashino na ani aho wadisota kashino na nzago adon dasho nishta okwande achinye go be dahini tindon ben dahini tra okot da o atse e benon stit na he jojo winsen he ni he na ado kodon juno nasko na nashtato jojo. And your first thought every morning should be, thank you. Jobalagan like with Nihe Hashin Sago a Beno, Katatin Dantati Nesnata Asgreda, a Beno Sadis and Totani Kaho. As need any here or eat as at Bes Kitchet Hito Bes Kitchet na Nishe do in Nawalieda. Do satoha ishi nantini don hilek do liesta. Jod as twido sani la yenda antina bahani zin. Akodi izel ebesnahas ago at das nakapa ahonosen do nakatenosen chik edo shidne. Di is in lini a ka ibe at si sahot Okashine nati is latino ashla beda hatne nana sa is latino ashla jokwa anal ke ado alala jade no nishita tanne okoti kosha ajendal nishi esheha is the bahatal net that non da atos kidi jo ajdo el neto hatel okoti ta mo yashakone ohonne that tabaho Jo skin ben his nahaton ne jo ati hajost at le o koto o konna o ni do o konna o atsa ba na hoston ne ka o yo ba si tke o konde jo an hi ni eshik edo shidne it is ni legend. You tell yourself no matter what I'm going through, no matter what my people are going through, no matter the kind of day I'm having, I'm going to make it. We're going to overcome it together. We're all in this together. Joto esa nihi ota. Ashi nita eto shaat ot sita tanosunde ejo. Do nihin hi hod nita di nida to konde. Jo hashin tsago eze ka ika epe. Which is zero beta, which is yado, saton ben japa. Oko kodesa atopa at sehi betos na eto hotos chata. Aita hats ato ada ajatos. Chohot av bansi kes. We strongly encourage our Navajo Nation employees to get vaccinated. It's highly, as a division director of human resource and speaking for the people, I strongly encourage our employees to get vaccinated. The reason why I'm saying that is if you have somebody that has not been vaccinated and is asymptomatic or has the virus, you're the individual that has been vaccinated will stop the spread. And I say I wear my mask for my workers, my people, my family, my brothers, my sisters, my elders, my aunties, and my uncles. I'm protecting myself. So if somebody comes with the COVID or is asymptomatic, if I'm immune to it, I'm not going to spread it to the next person. That's why it is important. We do have quite a bit of people that denied, that didn't want the vaccine. But within this week, we have more and more people that changed their mind and decided to get the vaccine. That's the reason why we're kind of delayed in moving forward with our essential employees. So you have to understand, we have to make time and effort for our elderlies, our 55 and individuals with health conditions. So Ado nihinat ani lini yahod na kodo benda ado o sha ninizana ado o sha tanosana an ille johot ada da ninde o yugo na antikinchik edo shidina en na nishi nakaatso na nishi kalek esala Kamato kaja etahana khashil sakon ho wadin jitaho ka alchina hatso ke hanale ke khake be ka anjel wo jokhot asa na nishteni tha ado khashina lan hike dan lini e nanish pa ataten nanish to beno tlingo khodet nanish ikacho pa inizini Aje na nishoshin to yate to ashe ini kodosata oyo ahashkena hano beyel tinte jo ena ado shanosana ani he beniyana ha ani hibena atolkit kodin cha aben sekes skihon sekes yilnini chadol Nihizado yatat ehodo nihin sekes do yat ego ado chadol ado bende dilla seta hunt So working hard for something that you don't care for or that you don't care about, that's called stress. An hit be'echet na hayosna. Do beno tlingo an hin hit sekesi bechet na hosna. Do khayda atida. Do khayda ba'antida jutaninde swidosani. So if you're working hard for something you love, it's called passion. Benet bijnet lidon juno kha big habijnet lon juno kha ani. Do bijnet ligo osa chon sa nanat olye when sekesi shin yitikis. Akoti khodo yo thode yen khilta holna aje yo thoha hotsoje khashit eshin khatsiga sekes aza taktil wato do hot ego that's the cost din hitsiga hitsis it ye da anhi o khayu ni hinako che ajito shni dan techo ze in da hondo et yakti ido et khato zihi e la khato ni hilcho hana a hada date za that's the cost jo aj be ka aye yo toje da hollo kodosan hicha zi it's na gado and sekes na gaje aj sabich hodeshne shinni kashin tsochen sabihi khe jon ni he on is atishne Aja bit hotation in za deep hotelne istla naspas istla nast istla di alla naspas istla adotost Asian Aja crisis hotline ne bit hotelne Aja lanch nido senta Oko kodo ihe bedini do les Mr. Dash nale ihe Aja nananihinanish adas any ba heta needs and uni hit the and lini Aja your toja de nisto da ostka oko sato na hapa ata hosyado ihe nihiti nido le Ado da isenol tain shikedo shidne ihe nan hiti nido le kojahata akisi and le koje shisha nahal shan nahal jishko as a satin is not deemed a yata is le okonde shatosha kato japa the hasnet has job and I cannot tin oko honsaga en hichahanana sito kwashin nane liado le chikedo shitne do aden da iso sain eta ta hosyado yo ta hino ne eta hata asi Sadia ehi be chiyata tke tanta hofne pesh bahane be sadia ehi be yajtke o hat isto hanse Vaccination o ko sadia ehi be yata tke ado hashine na ani nikidene dan lini be ke ta hastin ba dan no tra ajo sa be ha konni ni be chiyata tke Ek up petenitle, hashini la ashinit a hashin sako, nihichedo nihinet astel ani, a condit so the zembedethne, a cocod, saho con yasta the has lido, the has kindoni your niche do zeta, hashto zeta. Yat a heat at hot other bands of kashik, edo shidene. Ako saka hanana si dole ashi la bahadishnende kon saka na nishla dole dona hihe kuja da so kizi juno ni he ta do ato ni hito kato ni henna ta do ha aka jahanana khende sango ni henna de yes kato le na hihe shikedo shidne